Now, I know that Emperor McGowan is ridiculously popular in Western Australia, that he won that election by such a margin that, of course, there are just 2 members of the opposition in the lower house, and the Labor Party was able to not just win control of the upper house, giving it total control over the system in Western Australia, but they were also, via preferences, able to get not 1 but 2 legalised cannabis people to help do their bidding in the upper house. But the truth is that while most of the population of Western Australia was hoodwinked about how amazing that COVID response was, when really it was just locking off the rest of the country, despite the fact that, yes, their economy is technically in a surplus thanks to mining, the actual biggest source of revenue that comes into the Western Australian government is the rest of the country via GST. And as we told you, in the 5 months leading up to the state election that Emperor McGowan won oh so handsomely, the health system in Western Australia is busted. That ramping, the number of people who can't get a hospital bed in Perth hospitals has been getting worse every single month for the past 5 months. And today, horrific details about the death of a little girl who did not need to die, who is the ultimate victim of the health system that this bloke pretended was world class but was actually going backwards. Emily Evans with the details from Perth.
Nurses at Perth Children's Hospital say they raised concerns about staffing levels in the emergency department, worried adequate care wasn't being delivered. Workers mailed a letter detailing their concerns to their union 1 month before the tragic death of a little girl. The 7-year-old died at the emergency department on Saturday after waiting more than 2 hours to see a doctor. The desperate pleas of her parents had fallen on deaf ears. It's since been revealed 4 doctors had called in sick that day.
Having staff off sick, having that many staff off sick is not unusual. What is unusual is when you don't have the staff to replace them, and that is one of the big problems facing the WA health system at the moment.
The Nursing Federation claims WA's health system is in fixable crisis, but its 18,000 members are overworked and their hospitals are understaffed.
But here's the problem. There is no state opposition. There is no one in the upper house who can even launch an inquiry because of the total power that has been handed to the government in Western Australia.